topic is number 2, euthanasia. The argument that I was focusing on is if euthanasia is a slippery slope situation. For a brief background, according to Wikipedia Britannica, euthanasia is the act or practice of painlessly putting to death persons suffering from painful and incurable diseases or incapacitating physical disorder. Euthanasia has been a hard topic since the dawn of time. Some people believe that euthanasia is allowed and some people don't. My thesis is that allowing euthanasia does not open up a slippery slope situation. Assuming that euthanasia opens a slippery slope situation actually assumes that we are not able to set and maintain moral ethic boundaries. A popular counter-argument to this is that allowing euthanasia does open a slippery slope, that even though we try our best, the criteria for euthanasia is inherently flexible. People who argue this will claim that euthanasia does have a slippery slope because of the way that Canada is acting right now. Canada is one of the main countries who's actually falling down a slippery slope. Due to the recent bills that Canada is trying to pass, they started to slip themselves down the slope. Alongside this, the medical definition of consent has varied for years. In the medical field, there are varying definitions of consent and stipulations behind consent. Consent actually becomes a thing that you must consider differently based on the patient. Think about how a child can't actually consent, and dementia patients have limited abilities to consent. Shifting the rules to accommodate varying types of consent opened up this door for slippery slope. Dutch doctors and Dutch people have been discussing this for a while, saying that the concept of the word tired of life should be revisited until it's made and given a proper definition so that we don't have situations where people are allowed euthanasia when they shouldn't be. My rebuttal to claims like this is that if there's a slippery slope situation and your only source for this can be one country, then maybe we should look at what that one country is doing at fault. Let's look at Canada versus the US. Canada versus all these other countries that are having euthanasia and have had euthanasia for longer than them. If we look at Canada versus California, Canada has a lot to learn from California. Canada and California are similar size in populations, but Canada has seen a lot more deaths than California. If we look at other countries and follow down their path, it actually removes the slippery slope. If we're talking about mature minors and people who should not consent, there's actually complexity around this. Canada and other countries are not jumping to allow children the second that they change their laws. They're taking their time being stipulatory on who they let through, thus not creating a slippery slope. Looking at the tired life argument, we know that it can be broad, but under proper care, it actually still works. The Netherlands have had the tired life rule since around 2016. It has not caused them to fall down a slippery slope. These arguments that euthanasia creates a slippery slope are valid, but we need to understand that as euthanasia becomes more normalized, if we do stick to following rules, regulations, and stipulations, euthanasia will not fall down a slippery slope. My argument is that allowing euthanasia does not open a slippery slope, because assuming that we will have a slippery slope assumes that we cannot maintain moral and ethical boundaries. My first point would be that respecting autonomy does not require us to weaken laws. The Netherlands has been able to have euthanasia since around 2002. The laws have changed with time, but despite this, they have not actually fallen down a slippery slope. Keeping the fact that doctors can only allow euthanasia with several conditions being met minimizes the fact that they're falling down a slippery slope. Now looking back at Canada and California, we can see that Canada is falling down a slope. Canada has much to learn from California, but if they keep this, they actually will reverse their slope and go back to not having one. Ethically and morally, people do deserve to have autonomy over themselves and access to the services like medical assisted death if needed. Euthanasia has been ethically discussed for decades, but within this ethical discussion, we need to understand that people deserve the right to minimize their suffering. Comparing euthanasia to multiple viewpoints and multiple ethics, we can actually see that euthanasia does fit somewhere in these lines. But it's euthanasia that only comes at when people are in need of it. My second point would be medical ethical guidelines are actually stable enough for a slippery slope not to become a good thing. Regardless of euthanasia or not, medical guidelines already exist for death-related life choices. Things like removing life support, withdrawing medication, and end-of-life care are guidelines that have existed for decades, if not centuries. They haven't fallen down their own slippery slope yet because we keep the guidelines. Adhering to framework and guidelines removes us from falling down a slippery slope.